If you use your cell phone or tablet quite a bit, you may be experiencing some newer neck pain. What's that all about? Dr. John DiMaggio with Tulsa Spine and Rehab joins us to talk about it. Dr. DiMaggio, you're starting to see more and more people experiencing this type of pain, aren't you?
Yeah, it's partly to blame for the technological advances. Everything we seem to do these days, whether it be a phone, tablet, computer, or even computer at work, mostly work posture, is what we'll see is everyone's in a forward kind of rolled, flexed position. So what I mean by that is you're not sitting up tall, your head is down, you're looking down at something, your pecs, your arms, everything's kind of rolled in. So your back is overstretched, and the muscles on your back of your neck and upper back tend to get really tight. The muscles on the front are really kind of shortened and underused, so they tend to get weak and underdeveloped. And then you start to develop this muscular imbalance from front to back. Secondary to that, people get soft tissue dysfunction. And what I mean by that is kind of like knots or tension, tightness in their upper back. And then that often leads to pain. We'll hear a lot of people with chronic headache type stuff, tension stuff, things in their upper back and neck that are related to poor posture, not really a particular event that's caused their pain. It's just sort of something that's come on over time.
And that's just something that they can feel not only in the head, but maybe like you said, they could have headaches, maybe some upper back pain. I mean, it can present in various ways, right?
Correct. Yeah. I mean, two people from the same office, same schedules, same desk setup may have two completely different problems. So everyone reacts differently. And secondary to that, if one of those patients, like I'm just going off basic example or something, with the same environment, but if one is fairly active and they keep up with themselves and they practice a degree of home mobility or foam rolling or some kind of care for themselves, either icing after work or, working on neck stretching, they're probably going to be a little bit better off than the person that's just dealing with it, going from work to sleep or whatever, and not really addressing the issue at home.
Well, that led into my next question, and that is any kind of stretches or what can we be doing while we're sitting at the desk or what have you to sort of help mitigate this problem?
So the biggest advice we'll typically give patients that, obviously you have to work, you're at your desk, you've got a job to do. We don't want your employer breathing down your neck either for getting up and doing weird stretches in the office. At the same time, you can stand up and be efficient. So if you have for instance, if you have a meeting with somebody every Wednesday and you're on the phone for an hour, using speakerphone to take your, neck out of that precarious position. Secondly, you can stand up. Obviously they can't see you, so you can maybe do a couple stretches while you're talking to them. There's a lot of things you can do seated in your office chair. If you have a lunch break, we encourage you to maybe get out and walk a little bit, and just anything you can really do to break up that static posture. So just like sitting for 8 hours is going to be somewhat problematic. If you have a job where you stand for 8 hours, it's just going to be kind of the opposite. Maybe find where you can take a break, get off your feet, maybe lay down or, unload your spine to a degree.
So if someone comes into the clinic presenting with some of these symptoms, what kind of treatment might they receive there?
So like I was going back to what I was saying about tight muscles and tension and things like that, we're going to try to address the underdeveloped muscles on the front side, things that have become shortened and weak, with a couple of strengthening or stability type exercises. We're going to attack the tight, tense tissue on the back. Often comes with fixated joints, which is things we manage through manipulation and soft tissue therapy. So some of the hands-on things with like myofascial release or some fascial distortion, things that I do particularly. And then lastly, we're going to kind of give them, this is a 3, 4, or 5 step program, or these are a few exercises you should do at home to help once you've gotten over this, to keep it from coming back or from being so frequent or something you're managing on a regular basis.
For a comprehensive diagnosis of the pain bothering you, contact the team at Tulsa Spine and Rehab, 918-743-3737.